Ministry of Labour and Employment laga niche Employees State Insurance Corporation bra ajita kin laga sobse poila Regional Board meeting doshe Hotel Vivor Kohima bra Labour and Employment Skill Development and Entrepreneurship Advisor Moadoshi bi meeting de taishe aro dialogo Insurance Commissioner ESIC Northeast Zone Pranay Sinha aro Financial Commissioner ESIC Headquarters TL Yaten bi taishe Meeting de dagen ESI scheme do Nagaland implement korobole lagya obor kota kurishe Advisor Moadoshi bra State Government laga support dharabi yakin dilai dishe ESI scheme kundu Social Security scheme ase idu Nagaland de sobse bola par 2008 laga March 1 de introduce kurishe Dimapur de idia scheme do 8 district de implement hogina ase aru 9 de hwa nai ESI scheme implement hwa districts kan ase Dimapur Kohima Mukokchung Chumukedima Newland Seminu Walker aru Zinukoto
Respected Secretary, Labour, Sochola, Madam.
To come on board that time, that's why it was done.
So those accepted PNG rates, have you seen them?
Those workers who are working under you are over under our Social Security scheme. Once again, I thank you for attending this meeting. Thank you all.
We will now move on to the inaugural address. First, we
Security schemes for Nagaland in what we have implemented.
followed by Sir Puleshia Yeptomi, Joint Secretary, Government of Nagaland. Our third speaker will be Sir.
All right, first of all, thank you so much for sparing your time for Hornbill TV. Ma'am, so today in the meeting with the advisor himself present, you have spoken about the importance of ESI and how so far it has only been implemented in 8 districts, ma'am. And that also not the, if you look at the population also, it doesn't even reach half, I think, ma'am. So could you, before we delve more into the nitty-gritties and the details, ma'am, could you let the people know what ESI is first?
Okay. So ESIC is a social security net which is covers the medical requirements of people who are from very low salary levels, basically 21,000 and below. So not only the medical security, but we also give them unemployment, maternity, and disablement, so many other things which are there which we compensate in terms of cash, with of course a small amount of contribution from the employers and a very minimal amount from the employees. So this is a kind of a pooling account, so that when the need comes, then the persons are given the requirement. So now in this day and age, what happens is that your security of family, clan, especially in a place like Nagaland, where families are becoming more nuclearized as they're going out to work. So you don't have the whole village or the clan to come and help you, which was there earlier days. So now in single families or families which are isolated, these are very much required, because it provides you resources for medical treatment, provides you resources when you're unemployed, provides you resources when you get physically ill, or even for ladies also when they are unable to go and work, that some supplement of, some money is supplemented for them, for the non-working days.
Ma'am, so if we're speaking about medical security or whatever security-wise, ma'am, so would it be, since it's going to be deducted from someone's salary, an employee's salary, ma'am, does it have a certain amount as to this amount of security can be given, or that will be purely based on the amount of years an employee has been working, ma'am, the amount?
Yeah, so as someone has already mentioned, from the first day that he is already registered, the medical facilities are open from the first day itself. And even if the employee dies the next day, that, we give him death benefits immediately. So it is a kind of a commitment towards the lower social, structure. So that way, because they don't have anyone to turn to. So this is what is there. Yeah, yeah.
Ma'am, so we have so much to discuss because this is very new to, I believe, many people, ma'am. And why is it being a big challenge when it comes to implementing in Northeast, ma'am? Because it was discussed in the meeting, one area of focus is the Northeastern states, ma'am. Why is it being very difficult to implement when you compare it to the other states of India? And what are the big challenges you are facing right now to implement this scheme, ma'am?
Right. So one is that ESIC has certain parameters when it comes to implementing. So first of all, the most important requirement is that we have to have some medical arrangements, which is slightly a challenge in Northeast. Number two is that we require certain number of IPs for coverage. And the IP coverage, of course, IPs is insured persons. So these are the workers who are registered with ESIC. So if they are not, so that we need certain number of IPs also, or in certain number of registered employees, so to introduce the scheme also. And then we have to work in tandem with the state government. So there are a lot of challenges in terms of logistics, getting together people to register, first spreading awareness, and customizing it for the state. So we realized this, and the corporation made a special committee, and they've been, pushing for, some kind of, what would you call it? Some kind of special incentives for the Northeast. So even in terms of medical arrangement, we have said that whereas in other states they require, say, at least minimum 15,000 IPs for opening a dispensary. For Northeast, we have reduced that number to 10,000. And then even for opening a dispensary, we're giving additional funds, to help the dispensary be established. So whereas in other states they don't receive it, but we have increased it to almost 10 years now. So there are a lot of other benefits now we have introduced, which I feel the state government now will be able to work smoothly once all these challenges we're trying, as the challenges are coming, we're trying to give a way out so that that implementation will become easier. And also the main problem in Northeast is that, and specifically also Nagaland, is that the population is very sparse. And we are not an industrial, state. So now the state and also the ESIC have worked about, and as per our act, we have notified the factories or industries, and along with it, we have also notified establishments, which will also include schools and other shops, etc.
By schools, it will be teachers who...
Yes, teachers who are earning less than 21,000. So that is a capping.
ESIC will, the beneficiaries can be irrespective of government departments as well, ma'am, both for private and government departments as well, all the beneficiaries, the employees.
See, I think if they're already getting medical facilities from government, this thing, if they're already insured, then we will not be covering them. But if they are not insured, then we will definitely be covering them. Yeah, definitely. Yeah.
Okay, ma'am, I'll get back to you, but before that, sir, thank you for giving your time for Hornbill TV. Since the advisor, Muatoshi, was also present here, sir, and you spoke about working together with the state government. So far, since this scheme has been implemented in Nagaland, sir, have you been getting enough cooperation from the government, and have they been working well with ESI? Have they been working well to implement this scheme in the state, sir?
State government is giving full cooperation for the last 2 years especially. They are all proactively, they are also coming forward. The CEO of the scheme also, she is very cooperative, and advisor is even guiding us and helping us in all type of works that we can do. And he is also suggesting that the expansion of the coverage is our first motto. because the intention of the government, center as well as state, is to give this preventive medical system availability to all the workers of the state, so that nobody is denied the benefit of ESIC. Because as Madam has rightly told, that ESIC is not only providing medical services, it is also providing you this cash benefit, which is a dependence benefit. If death of a person happens, then family is getting 90% of the salary drawn by the worker as a dependent benefit pension for whole life. And then if some partial disablement is there, then also we are paying for the period of this cure. Till the person is cured, we are paying for the loss of earning capacity. If maternity benefit, 26 weeks we are paying. And apart from that, even a person is sick in private industry, they are not paying for the sick leave. For that also we are paying 70% of the wages to the workers.
Okay, sir, see, throughout the entire meeting, one thing that was stated was that ESIC implementation is mandatory, sir. But if you look closely, it has only been implemented in 8 districts. Are there any legal actions? Will there be any legal actions against organizations or departments that fails to make it mandatory, sir? Since this ESIC is also falling under the Ministry of India, sir.
Actually, for implementation of the scheme in any district, we have to first ensure the primary medical arrangement. So that arrangement and a minimum number of workers should also be there who are liable to be covered as our insured person, which is IP. So those numbers are catching up now. So we had a massive survey in the last year. We are in all districts of Nagaland, and we have seen that there is a last survey was done around 4-5 years back. So numbers is surging now. So that is why we are hopeful that we will get the numbers as per our requirement. And 8 districts has recently been fully notified. Although partial notification of municipal area was there in some districts, but now we have left with that, that concept has been left now, and we are covering the full district now. So 8 districts have been implemented. For another 8, rest of the 8, we are already, it is in the pipeline for ensuring primary medical arrangement so that we can implement in full state of Nagaland.
Sir, is land ownership an issue here? One subtopic was the ESIC trying to set up a dispensary in Dimapur supermarket area. However, it was there was some constraints, sir. So, is land ownership being an issue when it comes to the full implementation of ESIC?
No, actually, already we have a Dimapur dispensary, but the location is that it is far, a bit far from the clusters of IPs. So maybe some of the IPs are not coming there because response is not as to the level that we expect. Number of IPs visiting the dispensary is lesser than our expectations normally. So change of the location is being discussed now, and advisor has been kind enough to suggest us measures also how to shift and where to shift. So we'll work out on that. This has been discussed today itself.
Ma'am, we'll get back to you again. We are towards the end of the interview. Since today, one main discussion was how to carry this along in all the districts and how to largely implement ESIC, ma'am. Now, what is your next plan? How do you go about? One major department or one major area you have touched is the private schools of Nagaland, ma'am. So, how do organizations or departments reach out to ESIC if they wish to implement the scheme in their schools, in their organizations or departments, ma'am? How do they reach out?
Okay. So it is not just the school organizations, but we've also seen the contract and the hotel and restaurant organization being represented today. We're very happy about it because they represent the whole of Nagaland. And now the next step forward is to get them to register. There are certain documentations which are required. There are certain parameters which have to be followed. And in this, we have established a camp office for Nagaland exclusively, which is in Dimapur. Chumukedema. So along with our camp office and in coordination with the State Labour Department, they will, I believe they will organize some camps, they will organize some awareness, and they will also assist them in doing the registration. The dates will be publicized, and we will have to wait for the dates which they have earmarked. Yeah.
Thank you so much for sparing your time for Hornbill TV. Thank you.